Hi, my name is Alicia Azano, and welcome to my presentation on desensitization to aversive stimuli and situations. Desensitization is an empirically supported behavior therapy treatment for fears, anxieties, and phobias. Typical behaviors associated with avoidance of aversive stimuli or situations, as cited in a variety of literature, includes crying, screaming, elopement, self-injury, and physical aggression. Systematic desensitization is when a person with a phobia practices relaxation while imagining scenes of the aversive stimulus or situation, listed as a sample hierarchy for a person who engages in avoidance behaviors due to a fear of flying in planes. For this presentation, we will be focusing on contact desensitization, which is similar to systematic desensitization except that participants gradually increase contact with the actual aversive stimulus or situation rather than imagining it. For example, the terminal goal for one child who engages in avoidance behaviors in the presence of dogs may be to gently touch a dog. Their starting distance from the dog would be the average distance the child was able to stand from the dog during baseline. The child and therapist engage in a preferred activity together at the starting distance from the dog until the child shows no signs of distress. The therapist prompts the child to move 5 feet closer until they reach the 10 feet mark. The child is given reinforcement contingent on the approach behavior towards the dog and is then prompted to move in 1 foot intervals toward the dog from that point. On a variable time schedule of 60 seconds, the child is asked to look up and answer a question about the dog. This process is repeated until the end of the 30-minute session or when the child touches the dog, whichever comes first. During this process, if any avoidance behaviors occurred, the child was prompted to move 1 foot back from where they were standing or to a distance where the avoidance behaviors stopped occurring. The next session would start at the average approach distance from the last session. In the example, positive reinforcement was used with contact desensitization. Contact desensitization reduces the behaviors related to aversive stimuli, therefore breaking the contingency between the aversive stimulus and the aversive psychological experience. Then, positive reinforcement shapes increasing contact with the aversive stimulus. The relationship between the aversive stimulus and aversive stimulus function is weakened and is instead paired with positive reinforcement. In this article, contact desensitization was used for 6 children who engaged in avoidance behaviors when in a dark room at night. The illumination level in the room was gradually decreased to the criterion level or lower within 2 weeks following the onset of treatment. Ricardo and colleagues used contact desensitization to effectively increase proximity to animatronic objects for one 8-year-old male with autism who previously avoided any stimuli such as blinking decorations, dancing Elmo, or life-size Santa replicas. Shabani and Fisher used desensitization and differential reinforcement to effectively obtain blood samples from an 18-year-old boy with autism and diabetes who engaged in avoidance behaviors in the approaching presence of a needle. As previously noted from the example, Tyner and colleagues effectively decreased the standing distance from dogs for 3 children with autism who previously engaged in avoidance behaviors in the presence of dogs. Results were maintained at follow-up and generalized to a novel dog. There are several important assessments used to inform treatment. The behavioral avoidance test consists of performance tasks that gets progressively more interactive with the aversive stimulus. A self-report fear measure is also used to gauge the subjective experience of participants. You need to collect specific baseline data using the appropriate measurement dimension. This will inform treatment by providing a starting point and potential terminal goal. A preference assessment is required to determine the reinforcers to be used. Contact desensitization should be used when medical treatments are required, but avoidance behaviors prohibit its occurrence. It should also be used when avoidance behaviors impede and restrict daily living. Contact desensitization should not be used if you cannot arrange the appropriate contact with the aversive stimulus or situation, and when the individual only requires simple prompts and praise.